Warning: signs on the body that indicate you may have diabetes. Diabetes with 10 weird signs on your skin. Eruptive xanthomatosis. Acanthosis nigricans. Onychomycosis. Acanthosis nigricans. Diabetes mellitus. Insulin resistance. You can start off being very healthy, and over the years, you can slowly become a diabetic. Eruptive xanthomatosis. Acanthosis nigricans. Onychomycosis. Acanthosis nigricans. Diabetes mellitus. Insulin resistance. So, if you'd like to find out if you possibly have diabetes or pre-diabetes, watch this video through until the end, as we will also be exploring some natural remedies and diet tips to help reverse diabetes by reducing insulin resistance. Disclaimer: this video is for educational purposes only, so do speak to your doctor if you have any medical conditions. 1. Fungal toenails. People who have high blood sugars or pre-diabetes often suffer from fungal toenail infections, where the toenails become thickened, discolored, and yellow. They may also suffer from frequent athlete's foot infections, where the skin around the toes and the soles of the feet start cracking and becoming very itchy. What you need to know is that fungus feeds on sugar. So the more sugar that's present in your blood, the easier it is for the fungus to infect and grow on your feet. Diabetes and prediabetes also weakens your immune system, and this makes your skin more prone to infections from the fungus. Jock itch. Oral thrush. Ringworm. 2. Skin tags. Everyone has a skin tag or two, but if you notice that you're growing more of these little flaps of skin, this could be a sign of prediabetes or high blood sugars. The high insulin in your blood is weakening your immune system, causing a virus called HPV to come out of remission, and this can form new skin tags and sometimes warts. Many people who have reversed insulin resistance find that their skin tags naturally start to shrink and disappear. 3. Fingers pulled forwards. In addition to the hard skin in number 6, diabetes patients also find that their fingers become stiff and difficult to move because the fascia beneath is getting thicker. You may begin to notice small lumps or nodules under the skin on the palm of your hand, which can be sore to begin with, but then the pain goes away over time. This is caused by high insulin and insulin resistance, which causes thickening and unusual growth of the fascia in your hands. 4. Tingling feet. Although you visually can't see anything, you may sometimes notice and feel a deep, tingling, burning, itching, irritating, stabbing, or electrical shooting pain in your feet or your toes. This happens when the high blood sugars or the insulin caused by the diabetes or prediabetes is damaging the nerves in your feet by destroying the outer coating of the nerves and causing them to short circuit. Taking a daily supplement of benfotiamine can help to reverse this damage, but we'll talk more about diabetes remedies later in this video. 5. Skin bumps. Diabetics and pre-diabetic patients also tend to have higher levels of cholesterol in their blood, which the liver is struggling to break down. This starts to form these little bumps and lumps underneath the skin, which appear like a cluster of small, hard raised spots between 1 to 4 millimeters across in size. This can also be caused by thyroid problems, liver disease, and kidney disease, so please be sure to speak to your doctor if you notice any of these appearing. 6. Bed sores. People who consume processed carbohydrates or have insulin resistance or diabetes often suffer from ulcers. These are open wounds that form on the skin and do not heal quickly because the high insulin is damaging the blood vessels beneath them. Around 15 to 25% of patients with diabetes will develop a diabetic foot ulcer during their lifetime. 7. Hard skin on fingers. The skin on the knuckles, the fingers, and the hands can start to thicken and take on a waxy appearance if you have insulin resistance. So if your diabetes has not been controlled properly by making changes to the diet, the hands can become stiffer, and it can also feel like there's pebbles in your fingertips. 8. Dark skin patches. You may notice darkened areas of leathery skin on the creases and the folds of your body, such as the armpits, the back of the neck, or the groin. You see, when there's too much sugar and insulin in your blood, the skin cells start to reproduce too quickly and at a rapid rate. These new cells have more of the melanin pigment, making it appear darker than the surrounding skin, and it also has a velvety dry feel to it. Some people also have many tiny growths or skin tags growing on the patches. 9. Shin spots. High blood sugars from diabetes can weaken the blood vessels in the legs. This can form dark, brown, reddish round spots on the lower legs, especially around your shins. These usually disappear within 18 months, but they're very common with diabetic patients because of the high insulin or glucose damage to the blood vessels beneath the skin. 10. Puffy eyelids. Glucose, which is blood sugar, binds to water. So if you have high blood sugars and diabetes, you're also likely to have puffiness beneath your eyes. This does not necessarily mean that you're pre-diabetic, but if it is present alongside some of the other symptoms that I've talked about in this video, then it is likely that you have a blood sugar problem, and this could develop into diabetes over time if you don't correct your diet. If you've done this and you find that you do have a problem, you may also want to learn about some simple ways to reverse this condition. 1. Load up on anti-diabetic herbs and spices that reverse insulin resistance. Berberine, cinnamon, green tea, bitter melon, turmeric, black seed oil, fish oil. 2. Give your cells and your insulin receptors a chance to rest by cutting down on the high glycemic foods that quickly turn into blood sugar. Cut out the sugar, the starch, and the flour-based foods and drinks like biscuits, chips, sweets, breads, pancakes, pasta, ketchup, soda, etc. By lowering the carbohydrates that you eat, you reduce insulin resistance and give your cells a chance to catch up in order to balance your blood sugars. 3. Eat organic cruciferous vegetables every single day, like collard greens, Swiss chard, broccoli, Brussels sprouts, cabbage, and cauliflower. These foods are vitally important to reverse diabetes as they are loaded with the potassium and the magnesium that your cells need. These minerals make your cells more sensitive to insulin, whilst the soluble fiber and the phytonutrients they contain can directly stabilize your blood sugars. 4. Replace these refined carbohydrates and start eating healthy fats from avocados, pasture-raised eggs, grass-fed butter, raw coconut oil, and extra virgin olive oil. Healthy fats and proteins can sustain you, keep you feeling full and energized, and they help to reverse insulin resistance. 5. Sleep as much as you possibly can. Diabetics often struggle to get a deeper night's sleep, which can cause high cortisol levels, a stress hormone that will raise your blood sugars. In order to reverse the insulin resistance, it's vital to improve your quality and duration of sleep by getting an extra 1 to 2 hours each night. Or you can take a nap in the day whenever you possibly can. If you do this, you'll notice less food cravings the following day, as the sleep helps to normalize your hormones, it lowers your stress, and it balances out your blood sugars. There are also certain vitamins, minerals, and supplements that you can take to help reverse insulin resistance and diabetes, on top of fixing your diet.